Hi everyone, welcome back to It's Not TMI. My name is Lisa Flanders. I'm a physiotherapist. I work in Ottawa, Ontario, and I practice within women's and pelvic health. Today, we're going to continue our conversation around pelvic pain disorders, specifically speaking about dyspareunia. So what is dyspareunia? Generalized symptoms may include, but aren't limited to, pain with penetration, and again, this could include fingers and or a tampon. There might be deep penetrative pain, and pain can be anywhere from burning, throbbing, aching. It may last a very short period of time or may last for hours after the initial penetration. And dyspareunia is an umbrella term, so there might be a wide variety of reasons that you're experiencing pain with intercourse. So one of the reasons might be vaginismus, and this is something that we talked about in a previous video, and that's where we get that subconscious reflexive reaction due to fear of penetration. This may be related to vulvodynia or vestibulodynia, which we're going to cover in our subsequent videos. A person might experience dyspareunia following injury, childbirth, or some sort of traumatic event in and around the pelvis, which could include something like a car accident. Following surgery, so either hysterectomy or any sort of bladder or vaginal wall repair, can sometimes be the culprit for dyspareunia. We might also see symptoms of dyspareunia from emotional factors, and that can include things like stress. So when we're in this pandemic for the last 2 years, that type of stress might create more tension within the pelvis, leading to more pain with penetration. Different types of infection or allergy can lead to dyspareunia, along with some congenital concerns, including vaginal agenesis. So that's when the vagina is not fully formed, or when the hymen is not completely ruptured and it creates a membrane over the vaginal opening. How do we treat dyspareunia? Well, that's a great question. The first thing is going to be to get a differential diagnosis. So you're going to want to see your primary healthcare provider. You're also going to want to rule out any form of infection. So this can be from STIs or any other sort of skin condition, including lichen sclerosis, which we'll talk about in a later video, and or eczema in and around the vulva. Once a differential diagnosis has been made, that's when we can actually target what your specific cause is. And using things like lubricant. So again, thinking back to lubricants that don't have a lot of additives in them. And if you're not sure about the type of lubricant that's going to work best for your body, you can check out a couple of our videos. As always, we want to start connecting with our pelvic floor. So between our breath and pelvic floor function to create both relaxation and lengthening. And again, my colleague Andrea Plitz did a wonderful series on breath work and its relationship to the pelvic floor. Those are just linked above here. Finding a lubricant that's right for your body is going to be really beneficial when we're talking about dyspareunia. So avoiding lubricants that have any sort of additives in them, any sort of flavoring, tingling sensation, or cooling or warming sensations, making sure it's as natural as possible and preferably organic. And again, if you're not sure what lubricant's going to work well for you and your body, we have 2 amazing videos which are going to be linked right up above. Learning how to relax the pelvic floor muscles, and this can be through using dilators and or Therwands, which we have videos on both, linked above right here, can be a great way to start, again, connecting with the pelvic floor and creating some length within the body that can help when you're experiencing pain with penetration. To target any emotional or stress-related factors, talk therapy is an excellent way to go. There's counselors, psychotherapists, psychologists that are all trained within this type of concern. And as always, find yourself an amazing pelvic floor physiotherapist to help guide you through. I really hope that you found this video helpful. If you have any questions that you think might be TMI, feel free to link them in the comments below. Until next time, have a great day.